Hello mommies, new mommies, people that are thinking about becoming mommies. Today I want to talk about things that they do not tell you about after you have a baby. I was never prepared for this with my first child. Usually they talk about just the growth of the baby during pregnancy. Pregnancy is all that you're thinking about when you're pregnant. You're not thinking about after delivery. You know, you'll usually think about pregnancy and then you'll think about labor and delivery and then that's it. But you don't really prepare yourself mentally and physically for the things you're gonna go through after giving birth. They supply you with this pain relieving spray. The hospital provides this for you. And they will also give you this bottle. Let's see if you guys can see it. They will give you this bottle. And they also give you, I don't have these other two items, but they also give you these disposable underwear. And they give you this very big, long, thick pad. And it is very uncomfortable, but it is very necessary. After you give birth and they stitch you up if they have to, before they take you into the recovery room, they will put on this disposable. Sissy, stop messing up. So this is based off of my experience the first time around. I didn't know about any of these things. I knew to bring pads because of course you're going to be bleeding right after and you're going to be bleeding for a good four or 5 weeks. So, you know, I knew to bring pads. So I got super size pads. The super size regular pads that you would get are like, looks like a light pad. Like pads where you're just spotting or it's a very light period. That's what a super pad looks compared to this hospital pad that they give you right after delivery. Like that's how big it is. Oh my gosh, okay. So after you have the baby, and I'm not trying to scare anyone, everybody's experience is different, but this happens to be mine. So after you give birth and they stitch you up if they have to, they're gonna put this pad on you and they're gonna put this disposable underwear on you. And they're gonna keep this pad sheet on your bottom just in case you leak. Over time, you know, when you do get up to go to the restroom, a lot of the blood is gonna come out. So that big pad is a lifesaver for you because you're gonna bleed a lot. It's gonna, you know, it's gonna rush out of you to where you're gonna be like, oh my God, I'm dying, there's so much blood coming out of me. They have you go to the restroom and it has this thing in the toilet that actually counts how much blood is coming out. And I guess they determine if it's normal or, you know, they have to do something about it. I think really you need the disposable underwear and that big pad for, I would say your hospital stay. As long as you're in the hospital, I think it's good that you do use those items. Also, it's kind of hard for you to get up. You know, when you sit up, you might feel like the blood is rushing out. So it's you're kind of scared to get up all the way because you feel like it's just gonna all come down on you. Or at least that's how I felt. I'm doing a video. So when you do go to the restroom, go to use the restroom, they tell you to fill this up with warm water because you're gonna use this to rinse all the blood and all the urine off of your body, off of your vagina and off the back of you. You use this to rinse. They give you witch hazel pads, which are good. If you do have hemorrhoids, which a lot of women do get hemorrhoids after pushing because you're pushing so hard, so you do get hemorrhoids sometimes. So they tell you to put the witch hazel pads on the hemorrhoids to try to make them go away. And they have you use the spray, the pain relief spray, to spray in the area where you have stitches. And of course they want you to pat dry your vagina and your back area. It gets bad to where sometimes the nurse have to come and help you. Like the nurse, the first time had to come in and actually do it for me. Like I was just like, oh my God, this lady is changing me. Like what the heck? But I'm thankful for them because, you know, she did it with no problem, and she was just like, let me know if you need me to help you again. Like I have no problem doing this, and you know, she was showing me how to do everything. And so yeah, so this is the rinse with warm water, and then this is to put around your stitches so that you don't feel any pain. They also give you Motrin while in the hospital. I believe it's every, I don't know if it's 4 to 6 hours or every 6 hours. But they come in and they're always on time, and they give you your Motrin to help with the pain. These are the things that I experienced after giving birth. Now my second time around, I was more prepared. Because like I said, the first time no one actually told me I would have to use these certain items. Like I knew of course pads, but that was it. And lots of underwear, but I didn't think I would need any spray or something to rinse myself off. I wasn't even thinking about any of that. So that was something that was new for me. And Bridget, what the hell are you doing?
Oh, playing with Alex.
Oh. Yeah, I thought I'd just prepare you guys because I wasn't prepared the first time, so I thought maybe I'd share with you guys my experience and maybe this becomes helpful. And I will post pictures of the items that you do need when you are on your way to the hospital for afterbirth. Just wish you guys the best of luck. I hope my story did not scare you guys. I do have many different videos on my page, so if you guys want to check them out, make sure you give it a thumbs up and you subscribe, and I will see you guys. Bye. Hey mommies, thank you guys for watching. Hope it was very helpful. Make sure you subscribe and like, and stay tuned for my other videos. Thanks.